is Dr. Gerald Pierone. I'm in Vero Beach, Florida, and I hope that this website is able to answer some of your questions about facial apoatrophy and treatment with facial fillers. In this video, we're going to follow Jo, a typical patient who is coming in for dermal fillers, mainly because I think she wants to look like many people do. She wants to look younger again.
You know what they say, today's 50 is yesterday's 40, and I feel 40, and I would like to look 40. I work for myself, and I work with the public, and if you feel better about yourself and you feel that you look more presentable, you're going to be more comfortable in your relations with people in the public eye. I have been married 11 years, and I want to continue to look pretty for my husband. That's very important to me. Women are working out more, they're exercising, they're trying to make their bodies look good, so why not facial fillers? You're not embarrassed to go to the gym. Don't be embarrassed to get your facial fillers, or your hair cut, or your hair colored, or your highlights. It's all the same. It's just a way of looking nicer. I'm getting ready to leave in just a few minutes to go to Dr. Pierone's. I'm looking forward to meeting him. I've heard wonderful things about him. He does good work from what I've seen, and I'm just excited.
How did you get interested in facial fillers, or how did you learn about this whole idea and notion of doing this?
I'm getting older. I don't feel older, but I'd like to have my face fuller.
Sure. When you look in the mirror, what are the areas that you see that's your number one priority, number two, and then number three?
This is one where it's all baggy and saggy.
So one being, okay, where you have loss of volume out here, okay?
Yeah. I have this big line here that bothers me, and all this.
Okay. Is the first area is over here where you've lost volume, where it kind of drops down, and then another area being, especially when you animate your face, these lines in here. So what I'm going to propose is that we fill this area in here with Radiesse. Do the same thing, we fill this area in here with Radiesse, and the same on the other side, and we'll do a little bit of Botox up here, and then go from there. You know, in general, with fillers, it makes sense to do it, you know, you do most of the correction on the first occasion, and then come back 2 or 3 weeks later, allow the swelling to go down, allow the bruising to go down, and then any contour irregularities, any area that's not perfect, you then tweak. You know, you do a touch-up at that time. How long does Radiesse last? I would say 9 to 12 months is kind of typical. The nice thing about Radiesse as a filler is that it does lead to the production of collagen, but it's your own collagen. So for example, when we're treating someone and they need 4 syringes of Radiesse on the first treatment to get a full correction, a year later, as they're starting to lose some of the effect, they might need 3 or 2.5. They need less volume to get back to full correction. A lot of people, to some degree, you know, when we do this amount of an area, you're going to have some bruising somewhere. Some people a little bit, other people look like they're ready to go out for Halloween. It can really, so it can be covered up, but you can pretty much expect to have bruising. The other thing that comes along with facial filler is, especially one like Radiesse, is a tissue swelling or a puffy reaction. But that's again a 24 to 48 hour phenomenon, you know, that swelling. But just when you're done, realize that it's there, because when people don't expect that, even if they do expect it, you know, when you look in the mirror and you go, oh my gosh, what did I do? It's always scary, but be aware of that. And we'll put ice on afterwards, because ice tends to lessen the amount of bruising that people get.
Right.
Okay?
All right.
All right. It's very common too. A lot of people have asymmetry where they'll have more loss of volume on one side of their face than the other, just because it's when they talk, they use muscles on one side more. I don't really see a lot of that with you. You know, the volume loss you have on both sides seems to be about the same. Because we actually mix lidocaine together with Radiesse, and by doing this, Now we've got lidocaine, which is a numbing agent, together with Radiesse in the same syringe. And this way, when we inject, it's much less painful. It actually makes the Radiesse a little bit thinner, too. It makes it easier to inject.
This is not painful at all.
Joe, how's it going so far? In terms of pain, level of pain or discomfort, how would you rate this on a scale from 1 to 10? 1 being barely perceptible, 10 being, as bad as it gets?
Probably a 2 at the most.
Okay.
Some of them you don't even feel once you do the first. It's absolutely not painful.
I spent an interesting day with an ENT surgeon who, in his earlier in his life, was doing a lot of cosmetic plastic surgery, and in the last few years had moved probably 90% of his practice to facial fillers, mainly because he said when he was doing surgery, you never knew how someone was going to heal and scar, and if someone just spent $20,000 for a facelift, it had to be perfect, and you can't always guarantee perfect results with surgery. And he said with fillers, he knew that he knew where he put the product, he knew what he was starting with, and he said the results were just so much more reproducible. You have the scar from an old accident, and very smooth skin up to here, and then a drop off at the scar. And what I'm going to attempt to do is to fill below it to smooth it in so that it's less noticeable to the eye. Now, with the same caveat, you may, because of the swelling, it may actually become more noticeable for 24, 48 hours, but then it'll soften up. And this approach for a scar can often make a very nice difference. It's also used for people that have contour irregularities after a fractured nose. It can be useful, but scars from trauma, from previous skin cancer surgeries, can often be very useful. After we're done with the injection, we ask people not to massage their face or squeeze it, because you can definitely, end up moving the product. Within a few hours, though, that just doesn't happen. And again, lumpy, bumpy, a little bit, but you can just see that we're 90% of the way there. What I'm envisioning is when you come back, when all the swelling goes down, that some of these secondary lines, that just why bother? Because the larger area, once you do most of this correction, then you can start saying, okay, you know what? Let's get these little guys. So that's kind of where the touch-up comes in. Okay.
Absolutely.
All right. Good.
Thank
Very
you.
good. And up here, that scar, although it's a little bit puffy, it'll be interesting when you come back to when we get the film and look at the comparison with the scar. I think that's going to help you as well.
Okay.
Okay. All right. We're going to put ice on now.
All right.
Okay.
Okay.
Very good.
Thank you
Thanks.
so much.
Okay. Sure thing.
Thrilled. And it was so easy.